is Dr. Shannon Hobbs. Welcome back to the show.
Thanks so much for having me again. It's good to be back.
Yeah, long time no see, Shannon. Okay, listen, we know a lot of stuff. We both know a lot of stuff happens to your body when you are pregnant. So how can pregnancy affect your oral health? And also, what should all women be aware of when it comes to visiting the dentist during that time?
So worst teeth are just a part of the many sacrifices that are made to bring a child into the world. But the main culprit, of course, is hormones. So estrogen and progesterone, they can contribute to many different things that can happen in the mouth of a pregnant patient. That includes, increasing acidity levels in the mouth, which can compromise the health of the enamel, increase tooth decay and sensitivity, swollen gums, bleeding gums, which increase risk of infection, diverting calcium away from the bones to the developing baby can compromise the anchoring system around the teeth. Dry mouth from not being able to breathe through your nose. Tons of different things can affect the mouth of a pregnant person.
So would you say women should be increasing their visits to the dentist during this time?
Absolutely. I would definitely encourage increasing your visits to the dentist. Routine checkups, like dental cleanings are really, really important for the pregnant patient. They're very safe to be done at any time during the pregnancy, and even urgent treatments can be performed safely during any time. But we also just want to prevent anything from happening. And that prevention and care is what's going to keep you and your baby really healthy. So don't cancel your checkups or your appointments at the dentist just because you are pregnant. There are many ways that we can help our pregnant patients be comfortable and safe in the chair.
Okay, well, let's start at the beginning of the pregnancy journey. And for a lot of women, their first trimester includes morning sickness. So let's talk about, does this have an impact on our teeth and overall health?
Absolutely. Morning sickness, acid reflux can really compromise the integrity of the enamel. So when the teeth are exposed to that level of acidity, it basically thins out the enamel, it erodes it away, can cause a lot of tooth decay and a lot of sensitivity, make the teeth more brittle. And I'd say the most important thing to know actually is to not brush your teeth immediately after being sick. So after you vomit, don't brush your teeth right away because it actually can cause more harm than good by stripping away that enamel. So what I recommend is rinsing with a fluoride mouthwash or even chewing like a little like xylitol candy or gum or mint. That will actually remineralize the tooth structure, protect against cavities, and protect from sensitivity as well.
Oh, that's really, really interesting. A little late for us, but that's very interesting information. So let's talk about there's routine procedures. So some people need x-rays or even fillings. Are those safe to do at any point during your pregnancy?
They are, but we typically prefer to do treatments like fillings, extractions, crowns in the second trimester, so between the 4th and 6th month of pregnancy. But any treatment can be performed safely during the course of pregnancy. But the main goal is just to keep the mouth as healthy as possible. Of course, the most important thing is really to understand that we're really trying to keep the teeth healthy, and it is much safer to do that than to have any compromised issue like during the treatment. So for example, if you need anesthetic, if you need x-rays, if you need filling material, it is safer to just keep away any dental infection, any abscess, because it will keep the mother healthy and the baby healthy as well. So prevention is really big, but if we do need to do something, it's all safe to do. Obviously, we want to limit the amount of x-rays we take, but if we absolutely have to take one, we will. White filling material, all that stuff. We just kind of keep it all in mind just to keep the mother healthy.
What if a procedure, you mentioned anesthetic, like what if you need something done that requires an anesthetic? Is that advised? Is there a certain way in which we should do that as safe as possible?
So local anesthetics are totally safe to use on pregnant patients at any point during the pregnancy. Again, any treatment that requires a tooth to be frozen, we want to make sure the procedure is as painless as possible so as not to induce a stress response, because that's the biggest thing. We don't want to compromise the health of the mother. So definitely local anesthetics, totally fine. Again, we really just advise maybe not using epinephrine, but totally safe to use.
Okay, let's talk about gum disease. I know, super sexy, guys, but we know that gum disease is an indicator of overall health in any person, pregnant or not. So what should pregnant women look out for when it comes to their gums specifically?
Yeah, so I'd say every pregnant patient is at higher risk of experiencing pregnancy gingivitis, which is just when you have a little bit more swelling and bleeding because of the hormones that make the tissue swell. So it's just basically any food or plaque or debris that trap on the gums can lead to really uncomfortable gums, sensitive, bleeding, all that. So I highly encourage brushing and flossing as always. It can look like a bit of a crime scene in the sink because there will be a lot of bleeding happening, which is totally normal and very common. Usually it occurs in the first trimester and can last throughout the pregnancy. It goes away after delivery. If it persists, contact your dentist. But really just kind of keeping everything nice and clean, incorporating even a vitamin C supplement would be nice just to keep the gums nice and tight and healthy. But really, really common for our pregnant women, even if they're really, really avid flossers and brushers.
Is gum disease in mothers linked to premature birth?
So some studies have shown a correlation between periodontal disease or gum disease and adverse pregnancy outcomes, such as preterm labor, low birth weight, even miscarriage and stillbirth. Again, research is still ongoing in terms of that correlation, but we just want to be as prudent as possible and keep our pregnant patients as healthy as they can and reduce the amount of disease in their mouth.
Okay, what I'm going to say next sounds scary, so you're going to tell us if it is. Something called a pregnancy tumor. So what is that, and is that something that people need to be worried about?
So pregnancy tumors sound a lot scarier than they actually are. They look pretty scary because it's basically just an advanced form of gingivitis in a localized spot. So it's just this kind of like big lump of swollen red gum tissue, and it usually shows up in between the teeth and even on your front teeth, which is kind of nasty. It's not the cutest look, but it's usually just from food debris or plaque that basically just engorges those gums a little bit more. So just being really mindful of brushing and flossing usually can prevent that. It is not cancerous. It cannot spread. It goes away after delivery, and it usually only occurs in less than 10% of pregnancies. So it's nothing to be worried about, really.
You mentioned that mothers lose some of their calcium to their babies during pregnancy. So should expecting women be seeking out more calcium-dense food or a supplement during pregnancy?
Yeah, absolutely. We encourage a lot of calcium-rich, diet. So in terms of like yogurt, cheese, almonds, leafy greens, we really encourage that because if you don't have enough calcium, that calcium from the bones will be diverted to the baby that's developing. It won't come away from the teeth, thankfully, but it will. It can really compromise the anchoring around the teeth and the jaws. So we do encourage a high calcium diet. Also, if you have enough calcium in your system, it can also be in your saliva, which will remineralize your teeth if you are having a lot of acid reflux. So overall, highly encourage it.
So finally, what other increases in oral hygiene should expecting women consider during this time?
Pretty much just your basics. You're just going to want to floss and brush very regularly. I'm really big on water flossers, electric toothbrush. I love a fluoride mouthwash, fluoride toothpaste. So it's just really kind of being consistent with it. It'll make your gums feel a lot healthier. It will keep your baby as well very healthy. Again, don't be alarmed if there's a lot of bleeding. I know that can kind of be discouraging and scary, but it's just really important to keep those gums and teeth really clean. And I promise it will keep you and your baby healthy. And if you're having issues, obviously, contact your dentist and we'll take care of you.
Shannon, thanks a lot for chatting with us today.
Thanks for having me, guys.
Everyone watching, we're going to be right back. Don't go anywhere.